Thank you again for joining Data and Trend Reporting in the new Performance Dashboard presented by Anytime Pediatrics. I'll start off by introducing our panelists today. We are very excited to have Dr. Bradley Bradford joining us today. He is the president of and pediatrician at Pediatrics by the Sea in Delray Beach, Florida. He has also served as the chairman of pediatrics and pediatric residency program director at Mercy Hospital in Pittsburgh, and he has served as the president of the Pennsylvania chapter of the AAP. Thank you for joining us today, Dr. Bradford. We also have two panelists from Anytime Pediatrics. Sarah Connors, Customer Success Lead, and she's located in Nashville, Tennessee. And we have Heath Nichols. He's also located in Nashville, Tennessee. Anytime Pediatrics' Senior Project Manager and an expert on Anytime's new performance dashboard. Thank you both for joining us. So we can go ahead and get started. I'll hand it off to Heath to talk through a demonstration of the new Anytime Pediatrics performance dashboard.
Thank you very much, Darby. Hello, everybody. Thank you for joining us. What do we use metrics for? We use them to understand our current and our past state so that we can predict the future, improve care, and add to the bottom line. So after looking at my today's waiting room and some visits for today, I may be interested in looking at my past performance to see what we can do to improve. So I'll go to my dashboard, and I am signed in as Laura Smith. This is an Attest account that we just use for demos. You can see that in the overall structure here, I have a lot to show you, but I'm going to use about 5 minutes to go through what we've got here in front of us. In the top left-hand corner, you can see that there is a selection tool that will allow you to select different practices, physicians, and a time or date range. In this practice selection box, you can start by selecting whichever practice you are associated with as a provider, or you can select all of the different practices that you are associated with. Likewise, you have a list of clinicians or users from your practices who will display here, and it will automatically populate your information into the dashboard, but you can go through and select which clinician that you're associated with or all of the clinicians that you're associated with. Same goes for the date range. You can look through a range of dates starting with the current week, the current month, or the previous 2 months. So you get about a quarter worth of information here. In order to display the information, we simply ask that you, once you have the selection you're interested in, click the search button, and you'll see the dynamic change of the information being shown. You can also, by selecting the data and clicking the download button, download all of this information with actually a little bit more supplementary data that I will go over after we get through with the dashboard view. Starting in the top left-hand corner, you'll notice that there is a descriptive data table that will show you the number of visits that you've had, the average wait time that your patients experience, the average visit length, and a range of visit length times. You can also just hover your mouse over each of these to understand what they entail. If you scroll over to the right here, you can see the visit completion and visit type pie charts, which will give you a breakdown with the number, the numerical value, and a percentage breakdown to show you how many of your visits are completed, how many were canceled before they began, and how many were invalid. This can be marked by the clinician if there is an issue or with the visit, or if the visit does not need to be completed or charged or billed by the clinician for whatever reason. The same goes for the visit type. You can see the numerical value or the percentage value based on all of the different visits that you had in this selection. So again, this selection here, once you click search, will display all of these different graphs here. We could go into more detail, but just suffice to say that there are different visit types in Anytime Pediatrics. Of course, you have the scheduled, you have the virtual walk-in, which is kind of on demand when a patient says, I need a visit right now, please let me come in and have a visit. And then we have the instant invite, which I kind of think of as the flip side, where the doctor says, hey, I need you to come in right now. So we can kind of look and see within all of our doctors or within a specific doctor what is happening. So that's the top row, the quick breakdown. And then we have a sort of patient visibility here too. So after each visit, a patient is asked how the visit went. They don't have to answer, but if they do, we give them a selection of great, good, or not good. And then they can also provide a text response in a blank field, which is included in the data download. We'll get into that in just a moment. As you scroll down, you notice that there is a visit reason. Whenever a patient enters a visit, they're asked for a visit reason. They can select from a range of fields. At this point, there's around 25 or 30, but that list sometimes grows at your request. Each of those visit reasons is nested into a larger visit reason, such as medication, problem-focused, wellness. Sometimes they elect not to list a visit reason, or a problem follow-up based on what the actual specific visit reason is. So let's take a moment to look at what the data download looks like. I like to just create it in a table. So the information comes in a de-identified download. So there's no patient PHI in here. You can use a visit ID to match up that visit information in your platform, on our platform. And as you'll notice, this has all of the information that you saw in the dashboard, but there's a little bit extra. You may be interested in seeing what the longest wait time is. So you may sort it from largest to smallest and say, Dr. Mark Johnson had some issue here. And of course, this is test data, so this isn't necessarily going to happen to you, but there may be something where somebody has a 30-minute wait, and you may say, Dr. Johnson is having issues getting on time, so we can address that by speaking with him. You also may be interested in looking at some of the patient feedback. So you may want to understand, some of these feedbacks here. Dr. Blackwell was very helpful. He listened to my child carefully before providing a quick diagnosis and treatment. So it's nice to see that the patient has an opportunity to give you some feedback about a visit. As I mentioned before, there's also these visit reasons that have different categories. We have the wellness, which could be a behavioral follow-up, a problem follow-up. Perhaps a child had an ear infection that was treated, and they just want to have a quick get-together to make sure everything's going well. And of course, the problem-focused visits, they are going to entail a lot of different illnesses or injury, anything like that. So that, in a nutshell, is a quick look at our dashboard. I really appreciate your attention, and I look forward to hearing the rest of the panelists. I'll stop sharing now. Thank you.
Thank you so much, Heath. That was a wonderful demonstration.
It's my pleasure. Thank you.
So now we will hear more from Sarah Connors about ways that you can use data reporting in your practice. Hi, Sarah.
Hi, everyone. Thank you again for joining us. I'm going to take you through a few slides just on how your practice can use data to drive your business and more efficiency in your practice. Here at Anytime, we believe patients and providers want key metrics to help improve care, monitor patient satisfaction, and ensure virtual care quality across their practice. The next slide. So analyzing data at your practice can help you determine what's working, what's not working, where you can improve. Also, how best to maximize your telemedicine utilization, adoption, and overall benefit to your practice. As Heath just went through, you can get really granular with that information down to time ranges, clinicians, overall practice feedback. So again, a lot of really great information in the Anytime Pediatrics dashboard. Here at Anytime, we also like to utilize the PDSA cycle for innovation and quality improvement. So plan, help set improvement goals, do, carry out that plan, study, analyze that plan, and then act and adopt based on the feedback during that cycle. So some of the things within the Anytime Pediatrics dashboard that you can use to help drive your business is that patient satisfaction that Heath was mentioning. So after every visit, patients will be prompted to enter their feedback. Some of the time this is on the platform or their experience with the clinician. So this is a really good way to, one, just evaluate Anytime Pediatrics as a platform, hear what your patients are saying, and then also potentially leverage that feedback for your own marketing efforts. You can also see what types of visits patients are gravitating more towards, like we talked about, that on-demand virtual walk-in or scheduled visits. Kind of toggling between those different types of visits can see kind of where patients are gravitating and what can help drive more revenue for your practice. Then you can understand the visit reasons that patients are using most for telemedicine. So whether it's for sick visits, well visits, behavioral health, really see what those patients are utilizing and your clinicians are utilizing across your platform. You can also use AP data to really dive deep into the patient's virtual care experience. How long are they waiting to see their clinician? Are they liking telemedicine for certain types of visits over others? What time of day are they requesting visits? Do they want those scheduled appointments, or would they prefer to have greater access to their clinician with virtual walk-ins on the weekends or after hours? Again, going back to that PDSA model, you can really use the Anytime Pediatrics data to see what's working, try different things, and really determine what works best for your practice and your patients. And one of the great things about Anytime Pediatrics and being an Anytime Premier customer is our white glove customer service. So utilizing myself and Darby as customer success managers to help you strategize and use that data to see what's working for your practice. Look at your visit volume. We can help understand what benchmarks are related to practices and sizes in your state. Other strategies on workflows, and really just discuss a patient engagement strategy based on the data that you can see from Anytime Pediatrics. From here, I'll hand it off to Dr. Bradford to discuss how he currently uses data and reporting in his practice and how he plans to incorporate the new Anytime Pediatrics dashboard into his data reporting. I think you might be muted, Dr. Bradley, or Dr. Bradford.
Now that's good. Okay, thank you again, Sarah. And I would like to also say thank you to Anytime Pediatrics for pioneering in Anytime a pediatric platform that was pediatric specific and also supports all of us in pediatric practices across the country in terms of introducing specifically office-oriented telemedicine platform. Overall, we utilize data in our practice to analyze. We've been using telemedicine probably for about a year prior to the pandemic. And so we had some experience involving it. And we got into it because we realized there was a subset of our patients who seemed to prefer that kind of encounter for convenience, for time of day, a quick look at a child who maybe had, quote, pink eye, prior to going to daycare and being turned away in the morning, etc. And so we've looked at our volume, which has started off very low and grew exponentially, and then it grew multifold again with the pandemic, and has remained to a degree in that same level at this point in time. And so the question is, you need to use data to be able to sustain what you do with telemedicine and evaluate what you're doing, what aspects of it don't really work. Next slide. We like to see and realize from the data, you can determine who are people who are jumping onto your system for the very first time, and some of them may need some support in terms of technology and in terms of how to access, versus you'll find that there are a subset of people who simply like telehealth and they go on repeatedly appropriately, but repeatedly for their visits in lieu of coming into the office for things that can be done in a virtual setting. I think the other thing that is more complicated, but it's important in analyzing the data, is who are your patients? Are they patients who are part of your practice currently and simply fit the convenience or for a variety of other factors, particularly with COVID, that they preferred? Or are they also patients who have no established medical home and no pediatrician that they really see? And particularly in Florida, that's true. There's so many new Floridians who have migrated to the Sunshine State from anywhere that many of them either were used to doing a telehealth virtual encounter with a physician and are so new, and their child has the same kinds of conditions I've described a moment ago, they think of telehealth as the logical way to start. And I'm always impressed with patients who appear on our platform, and I know who our patients are to a degree, and usually, and can certainly find them in our database in 5 seconds while the patients are beginning the visit with me, and that they're not patients at all with our practice, nor are they linked to any practice because they moved to Florida. That may be a Florida-specific phenomenon, and it may not be unique. It may be unique to us and not true for every state. I can't speak to that, but I think that's important to sort out, because those are folks who need a medical home, not simply a virtual doctor, sort of like an urgent center who happens to be available immediately. And so there's some counseling involved with them. Next slide. We do look at what mix of patients. We've done a lot of work utilizing that data with advocacy in the state, such that parity, not only in terms of reimbursement, but even, I should say, coverage at all. Prior to the pandemic, as many of you know, telehealth was not as well, shall I say, covered as a expected benefit with many sources of reimbursement for pediatric care, including Medicaid, as well as many of the private insurers. Or there were complicated state legalistic practices that made it a little more difficult to access. Again, collecting that kind of data becomes valuable in assessing the future of telehealth. If you're in a community where telehealth is great and you love it, but there is no insurer that is covering it using that extreme, you're going to limit the access of your patients to that service. Next slide. Okay. I mean, going forward, when we looked at the dashboard that Anytime Pediatrics came out, I think there were a lot of things that were really very useful for us in practice to utilize, and I would urge us to use and expand their utility. It's very important in pediatric telehealth to carve out what kinds of visits you as a practice believe are appropriate for telehealth and can be done with regularity there. And every specialty of medicine where pediatricians has a niche in that regard as to what aspects of their practice are suitable for that. And by having the reasons for visits, whether they're problem visits, medication checks, etc., it allows you to get a handle on that, and also then guide your own patients that certain kinds of things are probably not going to be appropriate for telehealth, and it's better to have an in-person visit than virtual for those. So I think you're able to use visit reason data more than just simply, well, I had so many visits. Yes, I had a couple medication checks. I'm not really sure. I think a lot of us know that ADHD med checks to a degree are very adaptable on a virtual platform. And often one of the advantages of the virtual platform is for particularly behavioral issues, you're seeing the child in a much more natural habitat. You're not sitting in your office, maybe having waited longer than someone thinks they should wait, but in point of fact, they're on a screen with their a parent or significant adult who's, again, able to navigate them, and you get an idea of how they behave and how they interact in their household and what things are like, and a lot of information that you don't get in the context of the office. So for example, that's the kind of visit very richly handled this in that way. Or new onset, I had someone just the other day who had significant anxiety and depression and issues that were coming up, and the visit began with the parents on the call, then privately in consultation, then they brought their 11-year-old in. That's a richer way to do that kind of visit in many ways than in the office building, where around are children for well visits and earaches and strep throat and what have you. Next slide. I just want to comment on the data that they will now provide us on instant invites. I think that's an important component of the platform data, which we will be using. I probably, this data, I'm not sure if it's from our practice or national data. If it's our practice, would make sense. We do a lot of instant invites. An instant invite allows several things, but one of the advantages of instant invite is particularly to access the telehealth platform currently, placing your credit card in and all of that. For some people, it's a barrier. They don't want to, or they discover that they knew that their limit was maxed out, or there are problems with that. And our goal is to provide the service and provide care. And so they may have various kinds of insurance coverages, but they don't have a credit card that they want to use for that purpose. Instant invites allows you to override that. I mean, the line I use when I give instant invites is, I'm going to override the system and shoot you an email by which you click on it and you're right in the room with me. Well, it's not quite that simple, but it always sounds good. And I think patients, oh, wow, it sounds really easy. And they're pleased. And I no longer, we used to field a lot of calls from people who said the system wasn't working, and that was pre-instant invite. But I learned from working with the staff at Anytime that really wasn't what the system was working fine, but it really related to the credit card function in the process at the very beginning of accessing. And so using instant invite and focusing on that for a population of patients who are in need and need the access to care obviously becomes something of value. Next slide. Waiting time is very useful data. Obviously, I don't think waiting time from a dozen visits is going to mean a whole lot, really. It doesn't give you enough of a sense of what's happening really with a large population, as was shown by Heath on the slide he had, where he had a large number of data points for that. So, but I think the data is useful and gives you an idea from people who, and I've talked with some patients about it, who think that if they did wait 10 minutes total from the time they're there till the appearance of the clinician, that's really not in the comfort of their own home, perhaps. That's really a very different kind of wait than sitting in either an office waiting room or an office parking lot. Now we don't have a waiting room in your office parking lot in your car to be called in and then wait again for someone to come in to provide care. So when you contextualize it, that 10-minute data is really very real data that you can share with families about things and then work on to improve. If you see an outlier, if you see a 30-minute wait time, for example, as he pointed out, they'll say, well, I wonder what did go on that day. Visit length for 12 visits, average of a minute. Again, an average of 12. I'm not going to say it's a whole lot. And obviously, we have a range of visits from, I guess, it looks like it's 0 minutes and from 1 second to 3 minutes, 6 seconds. I'll say next slide. I don't have a comment on that.
Dr. Bradford, I'll jump in. This is data from a test account, not from Pediatrics by the Seas.
I just looked at that, but I can't make a comment on the 1 second visit. Really get the door shutter, so to speak, if you know what I mean. Okay, let's go to the next slide.
All right, so now we'll leave some time for Q&A. I see a couple questions in the chat. So I can start off by answering this one. We had a question come in. If you are considering offering a different visit type, can Anytime Pediatrics give basic data, like what % might a practice expect for instant invites? We can absolutely talk you through that data. That's a good conversation to have with your customer success manager. And we can help provide benchmarks with what other practices that are similar sized or in a similar or in the same exact state. We can definitely help talk you through that.
I can comment on that just as well, Darby, in a sort of a different light. Something I meant to mention at the beginning of speaking was, we used feedback from our, physicians, from our clients, from our administrators, from managers, and some people from outside the organization altogether to try and understand what data points are going to be helpful. We started, it's a light dashboard, so it's very quick and efficient, but we do want to continue to improve and expand, enhance certain features, and eventually we hope to give some of those benchmarking data points as well. If you speak with some of our clients, you'll understand quickly that we take the feedback and we implement it, we use it. And we're very responsive to our users. And so if there's something that you need to see, we are always responsive and love to hear that feedback. And we do, in fact, go forward and use that in a way that you will see results on your screen at a certain point in time. So I appreciate that question. I look forward to kind of enhancing the dashboard over time.
Thank you all again, and thank you, Dr. Bradford, for joining us, and to Sarah and Heath.